Hey kids, as we speak, I am gone, but I do want to make a video, so I apologize for things coming out not great. So first off, this weekend things have gone on. On Friday, I woke up, went to take a piss, and couldn't. And so went to the doctor, found out I have a urinary tract infection. I've been taking antibiotics and hurts to pee. Went to the gym on Thursday? Saturday? What is today? Today's Saturday. Thursday. Went to the gym and I like going to the gym because it's like writing, but physical, if that makes sense. It's a physical form of catharsis. I'm in pain a lot. Almost all the time. I'm in pain all the time. It's not necessarily like it's empowering, but there is a certain degree of comfort in being in control of your own pain. And the pain of physical exertion, having like that lactic acid going on in your system, is good shit for me because I'm used to being in involuntary pain all the time. So yeah, I like working out. I like being in control of my own pain. The other day, this past week, I forgot to take my medicine. One day, just one day. I forgot to take my medicine, and that day I heard voices. And it's weird because I wasn't hearing them before without my medicine. But maybe I'm stressed out enough that I don't know, it's weird also because it's fucking hard to think of words. It's weird because shit. What was I talking about? Oh, it's also weird. It's also weird because I'm pretty sure that's not how medicine works. Where if you don't take it for a day, your shit gets all fucked up. Pretty sure that's not how it works. When you take medicine, you continuously take it until you build up a certain amount in your system. And when you stop taking it, it kind of takes some time to lose its effect. And I mean, it's been 2 weeks. It's been 3 weeks since I started taking it. 4? 3. It's been 3 weeks. It just seems like it wouldn't happen that way, if that makes sense. It doesn't seem like that should be possible. But I heard what I heard. Maybe it's not enough to, I don't know, kind of take all the edge off, just enough so that I notice. I don't know. We're going to therapy, me and Diglett, couples therapy, and like, you know what I think of sex, my thoughts, attitudes, behaviors. I tell you a lot. I'm not super into it. And so this is a sex therapist. This is a sex therapist we're going to. And she's really nice. But I am not looking forward to it, if I'm being honest. She's really nice. But I've already said it. I don't get along well with mental health professionals. And it's not because I am belligerent. It's not because I, purposely try to make it difficult for people to help me. Though this might be, yeah, I might. But I'm not, I come in with a very good attitude, outwardly. And it just reminds me of, it reminds me of going to therapy with my mom. My mom would be in the sessions with me, and she just fucking hovered. Jesus mother. She would be in the sessions with me from when I was like 13, and it would cause me to lie. I would lie. And it wasn't necessarily that I feared judgment from my mother, though judgment does come with its own set of disadvantages. I didn't fear judgment from my mom, but I didn't want to rock the boat. I didn't want to cause any problems. And that is how I'm going to feel, I anticipate, with Diglett, doing couples therapy with him. And if I had to compare him to any person in my life, it would probably be my mom. Though my mom is very judgmental. Diglett can be at times, but it's the narrow-mindedness that is the problem. My mom is incredibly narrow-minded, and I hate to compare her to Diglett because she's on another level. But Diglett is narrow-minded enough that it is a problem. I know it's going to be a problem telling the truth as far as my disposition goes, because I will come in there all happy-go-lucky and like everything is fucking peachy when it's not, because I don't want to cause problems, because causing problems for Diglett causes problems for me, causes discomfort for me, causes shit like this for me. I'm also seeing a different psychiatrist because, that other one thought I was lying to her, and I'm not really interested in talking to people that think I'm lying. So I made a appointment with a different psychiatrist, and we'll see how that goes. I want her to be as impartial as possible, and I'm going to revisit the sessions with my mom. Being with my mom in psychiatrist and psychologist sessions kind of caused some issues, because once you're diagnosed with something, that diagnosis follows you forever. It never goes away. And I want to say second or third time, my mom started pushing for a diagnosis from my psychiatrist after I tried to kill myself. And like at the time, I didn't have a problem with it, but now I'm thinking about it, like, that shit, it follows you. And I don't think the doctor was able to evaluate me in the most effective way, because he was only given a few, 15, 30-minute long sessions. Like the first one I think was 30 minutes, and then the rest of them are 15. But yeah, I don't think he was able to make a proper evaluation of me. And even if it's correct, I would like for this new psychiatrist to look at me as a clean slate. Not necessarily that I want her to diagnose me on the spot. I don't want that, because that's the problem that I have in the first place. But I want her to be as impartial as possible when looking at me. So don't look at my diagnoses, just look at what you're seeing. Don't look at like the evaluations of other professionals, because I'm not sure. And I mean, for this doctor, I'm not sure if she would be even that great either. But I think from going with the opinions of doctors in the past, it's even more removed, because I'm different now. And I've developed a fair amount compared to when I was 15. So I think it would be better to look at me as not a list of diagnoses, but rather the symptoms, the actual things that are going on. We'll see. We'll see how that goes. And like my mom would, she would push for this diagnosis like it was so fucking important to know. But it wasn't like she did it to help me. She just did it so she would know what was wrong. So that it could be written off as something that wasn't her fault. I don't want to say that. That's probably not true. But there probably is some truth in that. But I mean, she never really looked up things about bipolar after I was diagnosed, so yeah. She just needed to have it have a name. I really hope the sex therapist is I don't know, not shitty. God. I apologize for being all over the place. I know this is all over the place. But, yeah, there's things going on. And hopefully we can minimize the things going on. At least the bad ones. At least the tiresome ones. I'll talk to you guys later.